Title: If We Can't Live, We Can't Heal. Ethiopia's Health Crisis. In the heart of Ethiopia, a silent emergency is unfolding. Not in the battlefields, not in political chambers, but inside the very institutions that are meant to preserve life: hospitals and clinics. Thousands of Ethiopia's health professionals, doctors, nurses, technicians, are on strike. They are not demanding privilege. They are not asking for power. They are simply asking to survive. Their voices rise with a haunting truth. If we can't live, we can't practice. This is not a slogan. It is a cry for help. A call from those who have given their lives to serve, only to find themselves unable to feed their families, pay rent, or even afford transportation to work. Ethiopia's health professionals are among the most underpaid in the region. While inflation soars, their wages remain stagnant. Imagine saving lives by day and skipping meals by night. And now, instead of answers, they are being met with handcuffs. According to multiple reports, over 100 medical workers have been arrested by government forces. Their crime? Organizing, demanding, speaking up. What message does this send to the nation? That healing the sick is secondary to maintaining control? Let's pause and understand the gravity of this. These are not just any workers. These are the men and women who held Ethiopia together during the darkest days of the COVID-19 pandemic, who continue to serve in conflict zones, who care for the poor and treat the wounded, often with limited supplies and broken equipment. And now, they are being silenced. Let's talk numbers. In many regions, a medical doctor earns less than the equivalent of $150 a month. That's not a living wage. That's barely a survival wage. In a country where food prices have doubled and transportation costs have skyrocketed, this is nothing short of economic suffocation. But here's the deeper tragedy. While these professionals suffer, corruption continues unchecked. Millions are wasted on vanity projects, political propaganda, and military operations. Yet when doctors ask for fair pay, they are labeled troublemakers. This is not just injustice, this is national sabotage. Because no country can thrive, no country can survive, when its healers are driven into poverty and fear. And yet, despite the arrests, despite the threats, they continue to protest. They continue to speak. Because they know the fight is not just for them, but for the very future of Ethiopia's health system. A system already stretched thin. Hospitals without basic medicine, clinics without electricity, patients traveling for hours just to find a doctor, only to discover that doctor has been jailed. Let's be clear, this is not about inconvenience. This is about life and death. If the government does not change course, if health workers continue to be ignored, underpaid, and criminalized, then a total collapse of Ethiopia's healthcare system is not a matter of if, but when. And when that happens, it won't just be health workers who suffer. It will be mothers in labor, children with malaria, the elderly, the wounded, the poor, who will have nowhere to go and no one to treat them. So where is the leadership? Where is the compassion? Where is the accountability? Why does a government choose silence and suppression over dialogue and dignity? To the Ethiopian leadership, you cannot arrest your way out of a healthcare crisis. You cannot intimidate doctors into healing the nation. And to the public, these health workers are not your enemies. They are your allies. They are fighting not just for themselves, but for your children, your families, your future. Let us stand with them. Let us amplify their voices. Let us demand a healthcare system that values the very people who make it possible. This is not a political issue. This is not an ethnic issue. This is a human issue. If a doctor cannot live, they cannot heal. And if a nation cannot protect its healers, it cannot protect itself. Ethiopia stands at a crossroads. One path leads to deeper crisis, the other to dignity, justice, and renewal. Which path will we choose?